This week, we're studying the state of Maine's request to the U.S. Department of Health and Human Services to allow them to bulk import prescription medicine from Canada. There's history with this issue in Maine. We've been working with healthcare advocates for nearly a decade in Maine on this topic. We spoke out against the proposal back in 2013 when the legislature passed it, and again years later when the federal court struck it down as violating federal law. We were honored to get to work with Dr. Kenneth McCall, a chemist and pharmacy professor from the University of New England, who tested medicine imported under that program and found counterfeits. They weren't from Canada, and they also lacked sufficient active ingredient, which is why we were surprised to see Maine repeat this idea. States have been submitting these plans to HHS for nearly 20 years. HHS rejects them because they never show HHS they've got a real Canadian vendor who's going to sell them real medicine at a price cheap enough that the state will save real money after costs. Importing another country's medicine supply is expensive. Once you've tested medications and repack and relabel them so nobody gets hurt from misdosing or a missing label warning, there isn't any savings left. Maine's plan didn't name any vendors they intend to buy from or any medicines they were going to buy, which meant that they couldn't tell you how much they would cost or how much you would save. They didn't tell you how much testing would cost exactly, or how much repackaging and relabeling would cost, or even which vendors they would use. These details are important because Canada has said for 15 years they're not selling their citizens' medicine to the U.S. Canada has roughly 2,000 drugs in shortage at any time, and they mostly don't make their own medicine. And the pandemic has made their drug shortage problem even worse. When drug importation from Canada first came up in 2005, the Canadian government nearly passed a law banning all drug exports to the U.S. And they recently told the White House and HHS that they think that this is a bad idea and dangerous to Canadian patients, which is a polite Canadian way of saying no. But here's the real problem. Because Canada will never ever agree to this, every taxpayer dollar that Maine or any other state spends on this idea is wasted. And because of the pandemic, Maine's state budget is experiencing a $1.2 billion shortfall. All the money spent on the Maine Department of Health and Human Services staff that worked on this was not well spent. And the money they paid to consultants to help put together this plan they submitted to HHS, not well spent. Americans want cheaper medication and cheaper healthcare in general, and there's a lot of good ideas out there. To start with, did you know that prices for generic drugs in America are cheaper than generic drugs in Canada in many cases? That market force has done more for 20 years to lower the price of medicine than any of these programs designed to siphon Canada's drug supply ever have or can ever hope to. It's time to let this bad idea go. Essential workers in Maine are desperately in need of personal protective equipment, and Maine small businesses are being decimated from the lack of tourism dollars. Unemployment is spiking. We should stop using precious taxpayer dollars and resources on a program that will never work because the country we're buying from, Canada, has said no. Want to learn more? On our website, we've got an in-depth analysis of Maine's plan, stories about the last time Maine tried and failed to do Canadian drug importation, and news about counterfeits in America this week. Check it out at www.safemedicines.org. See you next week.